Dr. Thompson-Assan's clear commitment to serving others has been recognized, leading to her election as the National Vice President of the association. Dr. Thompson-Assan has authored 3 papers and penned 3 books, all with the aim of elucidating the role of cultural efficacy in the realm of mental health treatment. Dr. Sandra is happily married and cherishes the joys of parenthood, blessed with 2 beautiful children. Let's all welcome, we are all blessed to have such a lovely, blessed person among us, so knowledgeable, so experienced to be part of this meeting. Thank you so much for coming, Dr. Thompson. Let's all welcome her. Welcome, Doctor.
Thank you. Yes, it's my pleasure to be here with you as well. And a big thank you for the opportunity to share this essential topic. Very excited about it, yeah. And I hope able to all get what we are expecting from Sandra. Okay, so kindly give me the opportunity to share. If you could make me a co-host so I can share from my side, because I'll be using slides. Great, I have that now. Please, can you all see my screen?
Yes.
Great. Okay, so as indicated earlier on, I'm so excited to be leading us through this essential area, which is identifying early signs of mental health experiences. But before I commence the discussion, I would want to quickly share a real life situation I recently listened to. And it's about the dream of a unique woman. So I'll quickly walk us through and we'll see how best we can connect the topic today. So this is possibly the most unbelievable human story I have ever come across in years, because it is about a unique woman. She spent most of her life pretending to be and wanting to be blind. In her words, and I quote, "I put in all my time into researching on how to go blind," unquote. And so she tried to take her own side the least painful way. The question is, why did she want to go blind? And even more disturbing, how did she go blind? This is the bizarre story of Jewel Shippen, who was born perfectly healthy. She had a healthy body and a healthy pair of eyes. And for the next couple of years, everything was normal up until she turned 3. Her mother would find her walking in the hall during the night. But while most kids her age would be afraid of darkness, Jewel enjoyed every bit of it. She said that by the time she was 6, thinking about being blind made her feel comfortable. And when her mother told her that staring directly at the sun would damage her eyes, guess what? It even became her hobby. As a little girl, Jewel would spend hours looking directly at the sun, and it didn't stop when she grew up to be a teenager. Well, for almost everyone in this world, turning blind would be a nightmare. For her, it was a dream. The dream was so intense that she would walk around with her eyes closed, pretending to be blind. She began wearing thick black sunglasses and using a cane. When turned 20, she learned how to read Braille. Over the next couple of years, Jewel became even more eager until she finally made a decision that will make her ultimate dream come true. A decision that shocked me. She decided to forever take her own eyesight away. How did she go blind? Well, to my disbelief, Jewel found a psychologist who was willing to help her in the process. Why would a psychologist help her? This is what Jewel said, and I quote, "I started telling him that I wanted to go blind permanently. told me to do research to show that I was serious, and then he helped me. And from that moment on, Jewel spent hours looking for ways to permanently blind herself. She resorted to chemicals until she found what seemed to be the perfect one. She said, and I quote, "I found a drain cleaner is little less pain, although it does a lot of damage to the eye." And the shocking day came. She met with a psychologist to prepare for the day she always dreamed of, the day she would lose her sight. Jewel didn't even look in the mirror for a final glance at herself. She didn't care. She was desperate and wanted to go blind as soon as possible. And I quote, "I was 23 years old and I had waited all my life for this chance. I took off the sleep shades, and that was the first and the last time I saw the psychologist's face." They first put numbing eye drops and then 2 drops of drain cleaner in each of her eyes. And then that was it. And I quote her words, "It was a screaming, violent pain. And yet, with all the pain, all I could think was, yes, this is good, but I am going to be blind." They waited for 30 minutes before they went to the hospital. Doctors still tried to save her vision, which was against Jewel's wishes, but they couldn't do anything as her eyes now permanently damaged. Do you think the psychologist who helped her do this was arrested at the hospital? The answer is no, because when they were asked to explain what happened, they lied. Jewel told her family the same lie, but when they learned about the truth, they all cut ties with Jewel. I quote her words, "I was so happy. I felt that this was who I was supposed to be." And it took about 6 months for the damage to fully take effect for Jewel to become fully. She even got disappointed that every time she opened her eyes, she could still see. So why on earth does she want to lose her sight in the first place? Well, the sad truth is Jewel is also suffering from a mental health experience. She has an incredibly rare mental health condition known as body integrity identity disorder, BIID. BIID is a mental illness that causes able-bodied people to believe they are supposed to be disabled. From a very young age, they start to feel like part of their body should be damaged. Yes, I know this is incredibly unique, but this and many other mental health experiences exist. From some people who suffer from it, they might feel like they shouldn't be able to stand, so they want their legs to be amputated. In Jewel's case, it's her sense of sight, her eyes, her ultimate dream of becoming blind. And even though she has been aware all along that she had this condition, she didn't receive the right help and she couldn't help herself. So finally, she unfortunately followed the voices in her head and made it happen. But if you ask her, she's genuinely happy with what she did, but she would never encourage anyone to do the same. I quote, "I don't have any regret taking my vision. I believe I should be born blind, and I'm happy the way I am." And this is quite possibly one of the stories, most unique stories I'm sure you have also ever listened to. It makes you have several mind-boggling questions, especially how one person's nightmare can someone else. Yes, mental health experiences are real and usually become detrimental when minimal or no attention is given to the early signs. So here we are. This is Jewel Chopin. We can see how it started from childhood. She could see clearly. And that joy, that voice that she heard made her eventually become blind. Now, I use this story to help us connect to what we'll be discussing this evening. And in the story, we had so many instances where she threw in signals, but they all went unnoticed. And that is the more reason why we are here this evening, to take notes, to pay attention, to be able to even sense the signals people throw in when the experiences, mental health experiences are developing. So first, we'll look at what mental health is, its experiences. We'll take some examples, look at the causes and how clinicians finally identify the exact experience and name them. And then our focus will be more on the early warning signs. Then we'll do some quick discussions in there. I'll ask a question for us to make some linkages. And I've come up with several activities we can engage in or share with others to prevent it or to reduce the early signs to minimal. And then there will be some concluding thoughts in there. Good. So what then is mental health? When we say mental health, we are looking at that state of complete physical, emotional, and social state, angle or dimension. So we are looking at how good you are able to take care of yourself, how independent you can be. We are looking at how you can connect and relate to others well, how you can contribute and be effective in your community, how actively you are even involved at the place of work, in your church, or with the family at home. At what point do we then say that someone is mentally unhealthy, someone is experiencing mental health issues? So when the way the person thinks, the way the person feels, or the emotions, or the actions, or the behaviors deviate from what is termed acceptable, normal. In fact, according to WHO, mental health experiences are one of the leading causes of disability worldwide. A more recent one I read was that WHO indicated that 1 out of 15 people in Europe are diagnosed with depression. And in fact, if we want to look at those with anxiety and all forms of depression, then we are looking at 4 out of 15. They went ahead to also estimate about 350 million people in Europe as having mental health issues, specifically depression. And focus was on more females than males. That one would be a good topic for another day, why it's always females and not male, although we see males also becoming depressed. And considering these numbers, we should note that there is a need for us to be well informed about those early signals, pay attention to them, seek for the right supports, and I'm using it again, the right supports, and then also be able to have intervention to help the person manage or do away with them completely. And then as I proceed, if I name some examples or some experiences and you are relating to them, this particular discussion is not necessarily to diagnose anyone. It's intended for educational purpose, for us to know how to identify some of those issues at the early stage before it gets worse, like the case of children. And then also, we being informed earlier is a way for us to get the treatment and intervention time. So I highly recommend that if you notice that either one or more of the symptoms I'm sharing with us all here, you could relate to them, then you go and see a professional mental health person or a mental health practitioner. Right, so these are some examples. I've just named a few here. We have anxiety, depression, schizophrenia, post-traumatic stress disorder, where I've specialized in. So you notice that most of my examples will be coming from PTSD, that is post-traumatic stress disorder, and substance use disorder, eating disorder, bipolar disorder, obsessive compulsive disorder, body dysmorphic disorder, and borderline personality disorder. Now, where are these experiences coming from? I'm sure most of you are asking yourself that question. Okay, where do they come from? There is no single cause of mental illness, but rather a contribution of many factors that can cause it. And I'll take my time to explain this to help us to know why it happens to others and not others. Okay, so we are looking at 3 main areas. One, it could be biological. It could be how we think. It could also come from the environment or families and friends we associate with. So in terms of biological, I'll look at genes, and specifically I'm going to use twins to help us understand genes very well. So if we have identical twins, or what we call the monozygotic twins, if one person, one of these identical twins is exposed to an event that is objectively considered traumatic, and the person is eventually diagnosed with PTSD, it is expected that the other twin, if exposed to similar situation, or a situation that is also leads to distress, then that person has a high chance of also being diagnosed with post-traumatic stress disorder. So what we are basically seeing is that it is through genes, it is inherited through genes, and that is the more I use identical twins. In terms of families, so in families, if there is a particular mental health issue that runs in a particular family, it will be surprising to note that not the immediate parents, but the children who inherit from the grandparents, one of the grandparents. Why is it so? That takes us to the two other steps over there. It sometimes depends on how you process your thoughts, the interpretations, the attributions, the meaning, the understanding you assign to things that happen to you. It also has to do with your environment, the support you receive from people. So I'll take the cognitive interpretations first. For instance, if you consistently feel in school you are not doing well, and then maybe you've been asked to repeat your level, or you've been asked to keep writing papers, how do you understand, or how do you interpret this particular situation? Someone will say, I'm a failure. I don't think I can ever make it. Why is it I can study hours upon hours, similar to what other people are doing, but I keep failing? I think I'm useless. I don't even need to continue with schooling. Some of these meanings are okay. You can listen to yourself, but if you dwell more on it, it triggers a sense of hopelessness in you. And if you have that sense of hopelessness, it leads to you withdrawing from people because you are now shy, you are anxious. Even when you have the opportunity to do any presentation, you wouldn't want to step in because you feel at the end of it all, you'll be judged as a failure. So the way you judge yourself after listening to those words you try to pronounce to yourself can trigger it, especially if you are predisposed to it. If you've inherited a particular disorder, say depression, say schism, from the family line. Now, the role of the environment. First, I will look at migrants. So, for instance, if we have migrants, usually they move as a result of political unrest, as a result of war, as a result of poverty. If they move to a new country and then they do not feel welcomed or they are discriminated against, they begin to develop what we call the emotional or psychological stress. They are unable to integrate well in the community. And again, depending on how they understand what they are going through, or if they are predisposed, as in they've inherited a particular disorder from the family, there is a high tendency that it will surface. Also, I will use this example. Assuming someone already has been diagnosed with a particular mental health issue and the person has gone for treatment and is being reintegrated into the community, depending on how community receive this individual, depending on how they make this person feel welcome, the support they will give, the care, the words of encouragement, if that is absent and the person is rather stigmatized against, it maintains the symptoms, it maintains the behavior, or it even makes it worse. So basically, the role of family, the role of friends is significant to healing or to helping people overcome the experiences, that's the mental health behaviors they develop as a result of maybe a stressful event or a more dangerous situation they find themselves in. I've already explained the note part here. As in, not all individuals exposed to stressful life events develop MHE, and it goes back to, is the person predisposed to this? How is the person understanding the rejection he or she is feeling at the workplace, the rejection he or she is feeling in the family, the struggles he or she is having in the marriage, in the relationship? And again, is the person receiving support after all the stress the person is going through? Is the person receiving support? If yes, sure, the person will naturally show some of the symptoms, but with time overcome them. Or if no, it's absent or it's minimal, then we expect the person to cross that line and eventually have what we call a sense of current threat that will lead to mental health diagnosis or disorders. Very well. How then do clinicians conclude to say this individual has anxiety, this person has major depressive disorder, this person has schizo, this person has borderline personality? They just do not look at you or, listen to what you say and that's it. No, they do several investigations. So one, they will interact with you. They will also speak with significant others. Where you are in the position to respond to certain questionnaires, they are going to avail psychological tests for you to respond to. They do what we call the clinical observation. Sometimes when they are interacting with you, when you are conducting the test, they will also be observing nonverbal cues. And sometimes you are even referred to go and do scans because the part of the brain correlates with our behaviors for them to have in-depth understanding of what you are going through. And then most clinicians, in fact, most professionals are culturally competent and effective. They understand the culture from which most people in Ghana are coming from, where they don't even know you're a foreigner. They delve deeper, read, ask questions, proud to firming the experience and naming them. So in terms of the cultural experience, you can't go and report to a clinician saying that, oh, this person of mine once in a while is speaking with spirits, is chanting and that, and I suspect the person has mental health experience. The question here is that who is this individual? If this individual is, say, a soothsayer, then once in a while we expect them to show these signs. Some will be in their white attire, and then they would have to speak to smaller gods. They will have to speak to spirits to help people deal with their situation. So if this individual is from time to time doing this, and it's also not affecting certain areas which I will be discussing with you soon, then we can conclude. So the cultural element is very essential. Clinicians are always interacting to understand the cultural and the cultural meanings, the cultural interpretations of every behavior each person presents with, so that it informs us as to how to move on with identifying the particular mental health issue. So finally, we now refer to our manual, what we call the diagnostic tool, to see which symptoms correspond with which particular disorder prior to diagnosis. So the idea here is that if you go to see a clinician based on what you're experiencing, they take you through a series of tests. They take you through a series of observations, series of speaking with other people, interviews, focus group discussions before they name what you are going through. And then that also informs a treatment or intervention forward. Good. Now we are moving straight to the early signs. Right. So there are markers that would help us to identify these early signs. One, if you see someone showing certain behaviors, you ask yourself, how many people in this community do we see exhibiting similar behavior? Statistically, is it 2%, 3%, is it 80%? How is this behavior different from what is expected of us in the community? In terms of mental health, have we seen people who have also shown similar behaviors and have been diagnosed as having mental health experiences or issues? So these are some of the guides, but let's now delve deeper. So if you find someone who is going through some difficulties from the workplace, in a relationship, in marriage, with friends, and the person is showing excessive forms of fear, the person is withdrawn, the person is having issues with their sleep, rolling over every time, not being able to sleep at night, waking up with swollen eyes, or the person is sleeping too much. Also, instances where the person is holding on strongly to a particular belief, and regardless of reality presented to this individual tells him what I feel, what I think is right. Also, when the person sometimes would say something about he or she seeing spirits, hearing voices, and all others are not seeing that. For some time and it's been persistent, then we are noticing that there is a concern that we need to look at. There is what we call the flashback as well. Sometimes people unfortunately encounter what we objectively term as sparking distress or traumatic. In their own quiet time, they have the entire event playing back. That is okay, because once in a while, depending on what we encounter, we do think about it. But if the thoughts about this event, if how the person is seeing this entire event has been like more than a week, 2, 3 to a month, then you know that there is a concern we need to relook at. And then usually when they experience the flashbacks, you notice that some become even anxious, some become aggressive, some will unfortunately be resorting to substance use, either drugs, either alcohol, some form of plants, just for them to cope. And that is so unhealthy way of coping. Sometimes people with all the underweight, they will stand before the mirror and then they tell themselves, oh, I'm overweight. I think this is too much. I need to exercise. And then sometimes to an extent, they even do not eat at all, or they purge when they eat, or they just do away with food. So if we have seen some of these situations and they've been there or it's been observed for quite some time, then we can begin to seek for help. Another warning sign is brain fog. So when we say brain fog, mainly we are looking at memory loss. So is there from time to time speak with, and then you've noticed that with this individual, they easily lose track of even what they are telling you. They easily forget. And again, it's been persistent. I use the word persistent because, hey, all of us once in a while we do forget and we need to ask for someone to support. But you notice that this particular way of recalling is becoming problematic. Then we know, obviously, this individual some assistance. Then we go back to what we call the poor hygiene. In terms of poor hygiene, we are looking at people who so do not even care about themselves. They just do not care about what they are again. In terms of maybe taking their bath, dressing well, as you know, this individual from the past, it's no longer happening. They suddenly neglect their personal hygiene and they feel like not even having the energy to do it, and they feel there's no need to even take care of themselves anymore. And usually this is linked to depression. And we also have people who neglect going out with friends or social events. They just cancel all plans, just don't want to be out there with anyone. They always find excuses. And in fact, they have no interest in socializing with even friends or their immediate family. And sometimes, if depending on what you've been exposed to, depending on the challenge that you are going through, which is okay, once in a while we go to at the workplace, in our schools, with friends, with families, depending on the challenge, if you realize that the stress is too much and it's often making you feel some tightness in the chest or breathing rapidly, then maybe you can take quick, rapid breath more than usual as your response to stress. And then if you try to calm yourself down by breathing in and out slowly for say 3 times, and again you do it for like a week and you realize that this breathing pattern is not usual of me, or you see someone go through this after encountering a stressful situation, then that help is required. As well, sometimes people take all the medications and they have, again, persistent physical pains or even stomach aches. When you have people experiencing this, and it goes back to, regardless of seeing a general practitioner or seeing their doctors, nothing is happening, but then you could interact with this individual to understand that there are other underlying issues, then you know that it's also one of the warning signs. Now, this would be the mind-boggling question. Am I considered mentally unhealthy if I experience any of the aforementioned symptoms? What answer would I have for you here? So, this is the criteria that will be of help for us. The symptoms discussed can happen to anyone. The symptoms we discussed earlier, it can happen to anyone at some point in our lives when situations are especially overwhelming. However, if most of them are occurring together and depicting the criteria of mental health issues or mental health experience that I am going to share with you now, especially increasing your ability to cope with daily activities, then we can emphatically say that they are experiencing some mental health issues that are needing immediate attention. So first, when you see someone or yourself, if you realize that some of the symptoms I've mentioned are something that you're going through or be exhibiting, ask yourself, are these symptoms or these behaviors or these thoughts or these feelings, are they making it unable for you to communicate with others in a reasonable manner? Are you engaging in behaviors that make life difficult for yourself and even others? Are you acting in ways that is difficult to even look at or makes people feel uneasy? Are you experiencing distress? Is what you are going through, is it creating some form of suffering for you? And then also, is it making you act in ways that are unexpected by people around you? Let's go back to the case of Jill shipping. So basically the way she was reacting even made the family move away from her. And then also, is it making you habitually break the acceptable ethical and moral standards of your culture? Our culture spell out clearly things we need to do, things we do not need to engage in. Are you from time to time finding yourself in these situations, or is a person around you going through the situation? Then we know that help is required. And then finally, we say, is the person experiencing things that are different from most people? Is the thought of hearing voices? Is the thought of, I've been asked to save people, and this time I've been asked to say, engage in, I wouldn't want to name, engage in this dangerous behavior to help save people. I need to do this to create a particular damage, and that is what the voice tells me to do. And this experience, come on, is not similar to all that we experience. So the experience is different from what the majority, and this also links us back to the statistical bit, what the majority engage in. Then we know that yes, help is required. Okay, so this is a quick discussion based on all that we've learned so far. Which of the following behaviors would you consider a mental health experience needing immediate attention? Would I have someone quickly respond to this? Considering alcoholism, being able to see sounds and hear colors, being overextended, that is taking on too many projects or activities at a place of work or at home, having conversations with dead ancestors. Would you say someone going through any of these is obviously experiencing mental health issue? Or which of these would you say it's a mental health concern that needs attention immediately? So to our audience, if someone would want to answer this for me, that would be great.
I think being able to see sounds and hear colors.
Okay, good. Is anyone having any alternative?
I think speaking to dead ancestors, hearing them and speaking to them.
Okay, good. Thank you so much. So this is what we can also look at to pick the best, or to pick which one we feel needs immediate attention. We need to go back to the criteria now. So the first person picked being able to see sounds and hear voices. So this individual who is able to see sounds and hear voices, is the person able to communicate in a way that makes sense to you? Is a person engaging in behaviors that make life difficult? Is a person acting in a way that is difficult to watch or makes others feel unease? Is a person experiencing distress or discomfort from the seeing sounds and then is a person acting in ways that are unexpected by themselves or even others? Is a person breaking acceptable norms? And is a person experiencing things that are different from, which of course it falls into the last one. The question here again is, how consistent is this behavior? And I'm linking us back to the soothsayer issue. So if a soothsayer is again, saying that they see sounds, they hear colors. To us, whoa, this is weird. But if the soothsayer do this for just a period of time as part of his or her practice, and the soothsayer is not in line with this criteria, then we are mindful of terming the person as having mental health issue. Now let's go to the second response, which says having conversations with dead ancestors. When we go to, I don't even know if we have some, well, I did my research mostly in the villages, so I'm not sure if we have some in the cities. There are people that, when people are encountering traumatic events, they would want to go and see. They would tell you, I'm seeing spirits in my home, and I think the spirit of this dead person always comes to visit. And they go to see people and they speak to spirits. This is brief, it's part of their practice. And then again, if you want to be sure if this person, this whether priest or this soothsayer is having a mental health issue, move back to the criteria. How it is affecting the person as an individual, how it is affecting society, and how it's affecting their daily activities. So these are the key areas we need to pay attention to. So in this case, before we say alcoholism, being able to see sounds and hear colors, being overextended, taking on too many projects or activities, or having conversation with dead ancestors, before we can say these are mental health issues, or one person, one of these indicators over there represent someone who is having a mental health issue, then we should visit the criteria. Its effect on the individual, on society, and its effects on their daily activities. But if it's a periodic thing, and it's more linked to the individual's practice, and then it is culturally accepted, the culture bit is very essential, then we are mindful of what we say. Nevertheless, as an individual, if the criteria is sort of confusing you, then it is important that you let this person speak with a professional, speak with a mental health practitioner. Thank you for the responses. Now to how we can live mental healthy lives, or the activities we could engage in to ensure that we are mentally healthy, or the moment you see people showing some of these symptoms and it has not yet affected them heavily. These are some of the things we could recommend or we could help them to engage in. So first, to maintain good mental health well-being, some of the things we can do include paying attention to your dream. So what you can do is, when you wake up in the morning, think about what you want to do in the day. Think about how you did it previously, how it failed, how it worked well. Don't focus so much on how it failed. Ask yourself, people have done the same thing. How did they make it? How did they succeed? Can I walk to them to ask questions? Can I speak to them, visit an institution to speak to them about my dreams or about how to excel? Can I speak to people I know have been in this field? If you don't have the courage, speak to family, speak to friends, speak to trusted others, and then ensure that you pursue that dream. Secondly, individuals must learn to connect. You must have that social network that will be effective for you when life is becoming tough. You must ensure that there are friends, there are people you could talk to, and where you feel that I'm not so comfortable talking to this individual, I don't want to talk to anyone, then there are professionals, there are psychologists, there are clinical psychologists, there are counselors, there are mental health professionals, psychiatrists. You can always speak to them and they'll be more than happy to assist you. You should talk about your feelings to a trusted person though, but where you don't trust anyone, please don't be worried. Don't let that distress persist, but speak with a professional. And it is not a sign of weakness, trust me. Good. Another thing you can do is to live a healthy life. Eat healthily, drink more water, exercise, read a good book, or sometimes you can put your thoughts in a book. You can, just journal your situation, the good parts, the the not so good parts. And if you're not good in confronting yourself, then I want to encourage journaling for you. You need to get a professional to assist you to get that done, else you escalate the existing situation. In fact, in terms of healthy eating, a colleague professor recently shared with us on our platform. You can all go and read Tori De Angelis 2023. This author has come up to tell us that eating salad, it's not only healthy for nutrition or for your physical well-being, it's actually helped to starve your depression. So I encourage us all, find time, Tori De Angelis 2023, read about it, and then see how you can also keep that practice ongoing. And then also, as mentioned, make sure you engage in all activities that are, that you find as hobbies. So I usually encourage people that if you want to exercise, sometimes can be annoying, can be boring. So find that activity or that exercise you find interest in, that you want to do more. I can use myself as an example. I love to play table tennis. I love badminton. So I can extend my hours playing badminton, playing table tennis without even feeling tired. So find that activity that will excite you to keep you going. And then as much as possible, try to be independent. Sometimes if the stress is too much, engage in house activity. You can take the opportunity to go and do washing. You can take the opportunity to sweep, to do some cooking, invite friends over to cook. And if you are done in the evening, maybe just do something unique. Something unique for me, I can just do, say, popcorn. I can have, say, chilled water by the side. Then you can just invite someone you can fool along with, and then the person will come over, you sit together, you can just watch something funny on the internet or Netflix or just any movie you have. And then when you are done, the person leaves, just make sure that you go back to bed and sleep. You will even be tired by then. And this is important than being alone and having some negative mindset, which is not encouraged. So let's move on. I'm going to take us through some activities that I'm hopeful that they will be helpful to all of us. But prior to those activities, I'll begin by sharing this with you. These are thoughts that we create ourselves. So it's okay that sometimes you engage in those negative thoughts. It is okay. You need to be curious about your thoughts, especially the negative ones. It's okay, but do not judge yourself. The fact that you are expecting a promotion and it's failed doesn't mean that you are a failure. Doesn't mean that people do not like you. Doesn't mean that you're not doing well on a task or on your job. The fact that a relationship is failing or it is failed 1, 2, 3 doesn't mean you are the problem. It is not always so. It's okay to think about it, but then ask yourself, how are these thoughts affecting my emotions? How are these thoughts making me feel? How are they making me even act? Is it affecting the way I keep myself up? Is it affecting my interaction with people? Is it making me just become withdrawn? Ask yourself these questions and don't throw away entirely, don't throw away entirely those positives. Sometimes we dwell so much on the negative thoughts such that we see ourselves as worthless. And as mentioned earlier, the moment you dwell so much on, they don't like me, what if, how could this happen? It was a mess, if only I had, how will I ever? I'm stupid, I'm a failure. If you keep listening to this voice, without rather finding ways of changing them as in dwelling on how good you also are. If you are that bad, for instance, at the place of work, they would have asked you out. But if you are still there, but it's just a promotion you are not getting, that doesn't mean that you are bad. Maybe they are looking at other things that perhaps you do not fall. It could be experience, number of years that you do not fall in yet. Look to that angle to prevent that low self-esteem, to prevent that tendency of becoming depressed. And finally, about this, I can say that we can always choose to act in ways that bring us closer to the things and the people that are important to us. One thing we need to notice that the moment we begin to, I say, call on these words to yourself, the moment you begin to define yourself with these words, and you are unable to dwell on the positive, go to talk to someone, get someone you are very close to, get someone you can trust. And if you wouldn't want to speak to anyone, there are professionals. Remember once again that you are not your thoughts. Just observe them with curiosity and make sure that you do not judge yourself. My favorite parts. Sometimes you are so anxious. Sometimes you feel like it's okay, I don't want to do anything again. I just want to be on my own. I'm stressing too much. This is just weighing me down. I encourage you to do what we call the rainbow breathe. So it's a fun exercise that helps you to use your body to change how you feel. And it can be done in your home. It can be done at any place you find it convenient. But of course, if you're not comfortable to let people see you, just hide yourself somewhere and get that done. So you can sit on the floor and cross your legs. You can sit on the front edge, or you can sit on the front edge of your chair, having your hands by your side. So what you're going to do is that you are going to connect, or you are going to match your breathing with some activities that you are going to do. So mainly what you do is that your hands by your side, as you sit at the front edge of your chair, you slowly lift your hand up, but prior to that, you are going to breathe in, counting 1, 2, 3. So as you breathe in, or you inhale, 1, 2, 3, as you are counting the 1, 2, 3, you lift your hand up, stretch it as wide as you can, lift it up till you are able to touch it, both hands up there. And then, as you are taking the hands up, note that you are forming your rainbow. And when you have it hanging up there, think about the rainbow form, how beautiful it is. And slowly exhale by bringing hands down, slowly breathe out. By doing this, you still formed another rainbow, but this time it's faded off. So what you have to do is do this slowly at the back of your mind, by syncing your breathing with the activity you are doing. And as you get that done, you are forming a rainbow. Enjoy your own rainbow, form it anytime. And it's part of you getting relaxed. It's part of changing your thoughts. And if you do this once again consistently and it is not working, then I encourage that seek professional support. But now to this 5-4-3-2-1 method. With this particular method, it helps you, it's a form of grounded exercise that can help you stay in the moment and avoid negative thinking and even worry. So it boosts your energy and it helps you face your day. It can also be done anywhere. It can be done in the car because you are doing it actually in your mind. It's only when you are alone in the room that you can speak them out. So you are mainly going to breathe in and out slowly. You are going to use your senses to identify things around you, and you just mention a bit of details about this. These things that you are trying to identify around you. So first, after taking in the deep breath, 1, 2, 3, breathe out, and then slowly you look around your surrounding. Look for 5 things. So mention 5 things you can see, and then give a bit of details about these things that you can see. So for instance, let me look, see, what can I see? Okay, so I'm just using myself right now. So for instance, in front of me here, I can see a table. On top of the table, it's tiled brown and ash. And then I can also see my fan. It has this golden plate and some white, I don't know the terms to use. I can see my chairs, they are brown in color. So basically, I'm looking at 5 things in my environment and giving some details about the things I'm seeing. Then now you move to 4 things you can touch. So here I can touch my mug. It's like summer green in color. I can touch my phone. It has brown case. I can touch my laptop. It's black and silver. So things you can touch, and give a little details about the things. Okay. Then now 3 sounds you can hear. So listen for the 3 things you can hear. Example, I can hear the sound from my ceiling fan. I can hear the clock ticking. I can hear some beeping outside. I don't know if there is a car out there. Yes. And now 2 things you can smell. I can smell the deodorants, my skin. What else can I can smell the aroma from my next door neighbor. I'm not sure what they're cooking though, but it smells good. And then finally, you name how you feel. List 1 emotion that you can feel. Because prior to this, you were anxious, you were stressing out, you've lost energy. And usually, prior to doing this, you realize that you are so disconnected with your surroundings. So following these activities, taking your time to use your senses to connect and naming some details, ask yourself, how do I feel now? You can do this twice, thrice, in a day, throughout the week. But if the behavior or if the thoughts, if the feelings, the actions still persist, then I encourage you to see a professional, talk to a trusted person. Another thing here is that if it's someone, you can also guide the person through some activities. Okay. Now, if you are with the right person, if you are married, if your culture gives you the permission, it's okay. It's okay. I'm hearing feedback. Okay, good. It's okay to enjoy sex with your partner. Sex will boost mental well-being because of the chemicals that you release during the process. And I'm wondering someone by now asking that all is she talking about? Well, sex can help you to relax. It takes your mind off everyday worries and anxieties. And during the process, you release what we call the endorphins and oxytocin. And these feelings, they are called the feel-good hormones, and it creates feelings of relaxation and intimacy with your partner, as well as helping you to stave off anxiety and depression. So if you find yourself in the acceptable state, please do have sex. And then also religious, spiritual, and cultural practices. So people believe that when they are going through stressful moments, when the going is getting tough, when the thought processes are too much for them, the negative thoughts are just too much for them, they pray to God, to Allah, to whichever belief they have. Some even read their Bibles, they speak to priests. It's about their religion, it's about their beliefs. Some also have that spiritual practice of just walking or taking a stroll with their pets or just having fun with their pet at home. Some people would want to hike. Some people would just want to walk a long distance. Some people would also want to go sit at the beach. You know yourself better. If this is what brings relief to you, I encourage you to do it. And sometimes, depending on what you are going through, you might want to have someone by you as you do it, or discuss again with a significant other or with a professional to advise you to go ahead to do it, to present an alternative to you. There is also the cultural practice. So during my master's and my PhD study, I came across this Momodika Karantia, some also call it Momodika Foetida, and then in our Akan language is Nyanya, in the Gans call it Nyanyra. Yes. So the belief is that it drives away spirits. So if, for instance, you've lost a loved one, and then you believe that people use it, it worked in your culture, it is accepted, people have used it, because from some people, I was told that they dip it in water to bath. Some, they just sprinkle it around. Some, they hang it on the neck and it works for them. So how does it work for you when it comes to your culture? Seek advice, talk to people who can be of help. And together with the other activities that we've shared, hopefully have minimal symptoms, hopefully you do a book of. But then go through all these activities and nothing is happening. I highly recommend that you go to see a professional. Pay regular attention to others. This is not just about us. We are staying with people who once in a while show some of these behaviors. Pay attention to them. Don't wait till it gets worse. Then you'll be like, oh, I saw them once doing this. I saw him or her once doing this. Immediately pay attention. Quickly go to the criteria. Check if this is what is humbly. Suggest to them people around to support. So these are my concluding thoughts. Giving due attention to our mental health is very essential because both aspects require equal consideration and care. Taking care of your mental health is equally important as taking care of your physical health. It is important at every stage of life, like I mentioned, in the case of dual Chopin. It started from age 3. Families did not even notice it. Mother did not even notice it. Unfortunately, the psychologist, which I'm wondering up to now, if it's a professional, that is why consistently I've been saying visit a professional mental health practitioner. They not even notice it. It escalated through adolescent, and now she is blind. Those were mental health signals that she was throwing in, but went to their blind side. Also, achieving mental health means being aware of our own capabilities, effectively managing the challenges, maintaining productive and fulfilling work, and making meaningful contributions to our community. Like I mentioned earlier on, being mentally healthy, take care of yourself, engage with society, engage with friends, engage with families, and then do your best. Just do your best at the workplace. Don't look for, anything to the extreme. Do your best. Seek for help where you feel that you are failing something. Just seek for help. And then if you are not having that trusted individual, speak to professionals. Do your best to make the society proud. When faced with mental health issues, individuals and others may observe deviations from their typical thoughts, emotion, like I said, to note if someone is having mental health experience. Usually it depends on if the person is able to sustain conversations with you, if the person is communicating something that is reasonable. It depends on their feelings. Is this person suddenly not coming close to people again? And then considering their behavior, is this person always panicking, always sweating, breathing profusely? Is this person, abusing alcohol? Then you know that there is a concern we need to look at. Okay. So if such changes are noticed, seeking professional help is perfectly acceptable, especially if confiding in trusted friends and family has not been effective. To seek assistance, one can visit a general practitioner first. You can go to the hospital because sometimes there are medical issues that they will need to rule out first prior to seeking mental health issues. Alternatively, if you feel these behaviors, this is just not me, then go to see a professional. You can see a clinical psychologist, you can see a counseling psychologist, you can see any psychologist where it is not their it is not their field, or it is not in their domain. They are going to refer you to the right place. And also see psychiatrists. You can find them in the hospitals, you can find them in the clinics. Speak to significant others. They're going to help you to identify these individuals. Okay. So it is important. Hey, where am I? So it is important to note that if you have mental health issue, it is not an entirely a weakness. It's not a big issue that you can't deal with. Instead, you need to just speak to people to help you to deal with it, to overcome some of these challenges, to yes, confront your thoughts, as I mentioned earlier. Confront your thoughts, but don't dwell so much on it, because hey, you're a unique person. You also have positive, you have strengths. Sometimes pay attention to your strengths and don't dwell so much on them. And then learn the right coping skills as well. I've taught you some coping skills you have to look at, and then also embark on a journey of personal growth. So by actively engaging in positive mental activities, maintaining productivity in daily life, nurturing healthy relationships, practicing spirituality, discuss that adapting to change and effectively managing the inevitable stresses of everyday existence. We actively strive to maintain a state of balanced mental being. So that is it. Thank you. I'm here to respond to your questions.
Wow, thank you very much, Doctor. I never knew that I was bankrupt in the area of health, mental health. I think this is an eye-opener, and I believe everyone on this platform has learned something new. It's time for us to ask our questions. So if you have any questions, you can raise up your hands and I'll give you the floor to ask your questions. Yeah, so time for questions. Doctor is ready to answer all your questions. Don't be shy. I believe there are a lot of questions. I believe there are a lot of things going through our minds, which we need answers for. Yeah, I can see Obed's hands up. Obed, you can ask your question, please. Obed, you have to unmute yourself and ask your question. Hello, Obed, can you hear me? Yeah, Obed, you can ask your question. Hello, Obed. Do you have a question?
Sorry, my hand is up. Can I ask my question if Obed is not ready?
Go ahead.
Yeah, mine is more like I don't know, is it a contribution or a question? She says something about, she said it again, that you speak to professionals, but in what I've realized is that especially maybe I'm in UK, in African society, we see mental health as an abomination. If somebody is going through maybe mental health condition, we classified it that it's not part of us. We are strong, we are Africans. Because I remember when I had my third child, I had a depression, and then I was speaking to some of my friends who are also Black like me, and they were all against it, that I shouldn't accept that diagnosis because I'm a Black woman and we are strong. So it's a disease for the white. So I think it's time that we use such platforms, because we've got a lot of Black educated mental, oh, sorry, my daughter is, oh my God. She will let me go. Sorry about that. Sorry. So it's just that if we are going to continue like this, we should create more awareness. I was so happy to see that we've got a doctor who is talking about mental health with us, and she is not. The happy thing is she's Black like us. So why can't we educate ourselves? Why can't we create the awareness that this is it? We have to, so that in order to help our children, help the generation. It's just, so it's not a question, it's just like, I don't know how to put it, like a contribution or something like that.
Thank you very much.
Please, my hand is up.
Just a minute. If doctor wants to react to that.
Okay.
Well, I was just going to say that she's very right, and it's something that, for instance, Ghana Psychological Association, we are busy doing now. We are doing our very best to reach out to people to let them understand that it's not weakness, it doesn't mean challenge, but rather if you see it at the early stage and tend to it, then you have the treatment or you have the intervention done. So thank you so much. We need to use such platforms to be educating ourselves.
Okay. Thank you very much, Doctor. Sister Irene, you can go ahead.
Yeah.
With
Please, when we were, doctor was talking about the mental healthiness activities. She mentioned eating healthy diets, that healthy eating habits. And then she mentioned a book. I couldn't get that book, the name of the book. I just want the name of that book.
Okay, so it's a write-up. It's an article that came up, I think, in June by Tori DeAngelis, Tori, then the DeAngelis is DeAngelis, June 2023.
Oh, okay. Thank you.
Yes, in fact, if you have access to my slides, I've put the link in somewhere.
Okay.
Yes, the link. Yeah, the link is here. That's the first one.
Okay. Thank you.
Sure.
I can see Augustina Chase hands up. Can you go ahead with your question? And before your question comes in, I've put in the article. I don't know if I'm right, Tori DeAngeli, on the group, on the chat. I guess that was what Doctor mentioned. Yeah, you can search for that. Sister Che, can you go ahead with your question?
Yeah, good evening, everyone. This tonight's topic has really struck a chord with a story I heard about a lady who is going through the challenges of cancer and the stress of the whole thing, leading to what this lady was thinking could be mental health affecting her and her husband, to the point that she tried to reach out. This is a friend I'm talking about. She tried to reach out to her husband's family. And in fact, what she is going through, in fact, is become a whole war, family war, because the family won't accept that their brother is going through mental health, whatever that he's going through. And this lady is being stigmatized. So as doctor was going through the whole, what could cause, things to do, this person in this case is not being given the right support, especially from his immediate family. So in this case, what advice will you give? Because it's leading to this lady's marital breakdown. She needs help, no family support. In fact, she's being attacked in return. What advice do I give this friend?
Thank you for the question. And what I would want to say is that if indeed the lady has identified that, considering the criteria I just shared with us, the husband falls in all the criteria or most of them, then the challenge will be why the husband wouldn't want to go. And it's actually expected. I was discussing this with a colleague who is currently with us on the platform here. This question came up in our discussion. And then what we looked at is that the lady must begin to work with the husband using what we call the deep. So first, the lady must listen to what the husband is going through, listen to whatever the husband has to share. If there are certain beliefs the husband is holding on to, the lady should just listen and validate it at the start. And then now, as the lady keeps listening to the husband, the lady must try to show empathy. So just like enter into the worldview of the husband, trying to act like, yeah, I really understand what you're going through. And if I was going through, I would have done the same. By doing this, you are trying to agree with the person, you are strengthening a relationship, okay? But you are not agreeing to totally agree, but you can agree with this individual at some point to disagree. So here, as the person is throwing in certain beliefs, you can gradually also chip in reality. That is gradually. So you are not there to disagree with this individual, otherwise you will lose the case completely. So the question is that what approach is your friend using? Then, as you try to have that discussion with the husband, you are or you are trying to encourage a relationship, that partnership, that will make this husband understand you at some point. It is not going to work out immediately. Understand at some point. And where you even say, or you form that relation, you even suggest that go to visit maybe a practitioner. With time, the husband will listen. But sometimes the approach to getting people to see professionals, the approach is also wrong. And if it's wrong, it leads to mistrust. And if the person doesn't trust you, you can imagine the conversation this individual is going to have with his or her family and its effect on you now. You would maybe be tagged as the one having that mental health issue. So the question is, what approach is your friend using? Is she there to listen? Is your friend showing empathy by entering the worldview of the husband? Is your friend validating the experience, trying to agree that, oh, it's okay, this is it, but how about that? With time, you don't expect it to work immediately with time. And then has your friend build that rapport, that relationship that will enable the husband. So let's assume the husband said, today, I feel like going to the beach, but yes, agree. Then tomorrow you throw in, next week, I feel like going, or we going to see a practitioner. So it's about building a relationship and not trying to show I know it all, I feel it's a problem, let's get it resolved. No, people experiencing mental health issues, most of them even feel you have the problem and not them. So let's look at the approach first, and then we can take that forward.
Oh, thank you very much.
It's a pleasure.
Okay, I can see your hands up. You can go ahead with your question.
Thank you. Good evening, everyone, and thank you for having me here. I missed a bit of the talk, and I'm not sure whether this was mentioned. I just wanted to find out if Dr. mentioned anything about menopause and how it affects mental health in ladies, because I know that there are hormonal changes that sometimes can affect moods and that, and what women need to be looking out for and what they need to do in such circumstances when they are approaching or in menopause and they find that their moods are swinging, really. Thank you.
Thank you. Thank you for the question. So we know how So we know how menopause presents itself in most women. Some are okay to go through it, like you rightly said, some also end up having mental health issue. So towards the end of your submission, you mentioned that when it starts, so it has to do with you and the person around you. When it starts, what are the changes that you see with the person or with yourself? As soon as you notice something different with yourself, then again, I encourage you, go to a doctor first. Because when it comes to the medical aspect, I can't advise. I can do more of the mental health. So you should go to a doctor first if they would want to give some medication or they would want to give some advice to you and your immediate others. And where the doctor feels that considering these behaviors, you need a mental health practitioner, obviously the doctor will make that recommendation. So let's attend to it, like you said, right from the start, when you notice the changes, and seek for more education as to moving forward.
Thank you.
Thank you too.
The floor is still open for questions. You can let me know by raising up your hands and I'll give you the platform to ask your question. Doctor, with Ahmed's question, I think I have a close relative who also is in the stage of menopause, and she easily forgets things. And you made mention about brain fog. So how is it linked? Can one, should I say, interchange mental health with the stage of menopause? Is it possible?
Well, earlier on, I stated that periodically we all do lose some concentration, or we all do forget what we even want to say. Sometimes I mean to go and pick something, I get, I'm like, hey, you are blank, you don't even know. You get back and then yes. But the issue here is that how consistent has this been? How is it affecting that individual? Is it to the extent that the person says, I'm going to the market, and ends up market at committee one and ends up saying go for it from Teman and ends up in go for it, just join the car, doesn't know what the person is going? So its effects on the individual to a larger extent will help us to know if the person indeed is experiencing mental health. But sometimes I've been saying, do not wait for it to get to the worst stage. Now, at least you know the criteria. Now, if you don't even recall anything, look at its effect on the individual, how it is affecting the person and people around him or her, and then how it is affecting their daily activities. You can use just these three. If it is making the person persistently, forget, and it's having ripple effect on other things, and again, it is extending, then we know that there are certain experience, mental health experience this person is going through, and be needing immediate support.
Okay, thank you very much. Emmanuel Bing, I can see your hands up. You can go ahead with the question.
Hello.
Hi.
Hello, good evening.
Good evening.
Hello, good evening. Hello, good evening.
Good evening, Emmanuel. You can go ahead with your question.
Yes. I want to find out. Something happened last week. I was doing attachment at General Hospital, Tema, psychiatry unit. A lady popped in with 3 kids, and she was complaining that she's smelling. And so the doctor in charge asked her, what shows that you are smelling? Because we could not feel any smell from her body, nobody odor, neatly dressed. So the doctor examined, and the lady showed us a series of tests to check either she really smells. But there was nothing like that. So the psychiatric nurses and then the doctors told her that she has no problem. But she was still insisting. So I want to find out what type of mental health is this? Thank you very much.
Thank you so much, sir. So if you ask me to immediately diagnose, I wouldn't be in the right position to do this, because earlier on I stated that we triangulate our data, we do series of investigation to firm or to name a particular experience. So right away, there are several things I would need to do. I would have to observe this person. I would have to listen to this person. Possibly I would have to talk to people around this individual before I can rightly name the challenge the person is going through. But if you could also tell me, what has the practitioner at your end engaged the person in?
Okay, madam. Earlier on, the lady provided testing, sinus tests and other tests that she has made just to find out if she has infection or body or whatever it is. But both from all the test results that she showed to the doctor was negative, like nothing of that sort. And the doctor also took her through some probing questions just to find out if he's really having mental issues. And it's like she still insists that, as you said, it was early to determine. But we realized that according to her, because of that, she has left the church that she's going. And then he thought that people talked about her. So even when he goes to board the car, but as your husband complained, he said no. Your neighbors had complained, said no. So why then you suggest? He said that at times you can see people showing some attitude towards her as if she's smelling. And that is why she also believed that she's smelling.
Okay. Okay, so like your practitioner said, we have to do other investigations to enable us if indeed it's a mental health issue, which specific mental health issue it is.
Okay. I think, Obert, I can see your hands up. If you can unmute yourself and ask your question.
Thank you. I have a close relation who sees sounds and then she hears colors. And she's always talking with the dead, the ancestors. She doesn't sleep at night. And we tried several times to send her to the hospital. But she wouldn't go. She said she's not sick. And we told her, no, nobody has mentioned anything that, oh, this and this and that. We just said we want to go and check your BP and the rest. And she wouldn't go. So we spoke to the children. And the children, because they are outside, they came down and they are saying, it's her right. If she doesn't want to go, it's her right. But the woman is deteriorating very fast. Can the professional visit her at home? Thank you.
Thank you so much for this question. Well, it goes back to the approach, okay? It goes back to the approach as to how we even speak with this person. Are we actually listening? Are we letting the person understand that, oh, it's okay, we know what you are going through, it's okay. But when sometimes he or she presents us with certain information that she's heard this, she's seen that, how do we even respond to that? We just say, oh, we are going crazy, what is it? How do we say, oh, it's okay, really? Tell me more about this. But what about it? Then now you are presenting reality to this individual. So I would say it goes back to the approach to get this person. And then, like you said, she doesn't feel there is anything wrong with her. Maybe it's you that is rather going through a problem that is to her, to this individual. And then to the point where I say, if you can get the professional home, again, it's the approach, how you are talking to this person to accept this professional you are bringing home. And look at the number of professionals we have, the ratio. And then also bringing a professional home is quite expensive. And if the professional is coming home, is this individual willing to allow the professional work with him or her? These are questions we need to ask ourselves. So the background work should be done well. Avail the opportunity for the person to know that you care, for the person to know that I'm here to buddy you. I understand what you are going through. If the person wants you to do something for her, you can slightly chip in, okay, I'll get this done for you, but you would also do this for me. It takes time. It needs more energy, it needs more care, more encouragement, more love from you. That is the support system we've been talking about. And if this succeeds, and you get the person say, I would go to the clinic, that is fine. The person says, bring the practitioner in, then you will now have to go and look for a practitioner. Like I said, it's going to be expensive because coming home to it another thing altogether. And then you can get a practitioner. But trust me, you can bring in a practitioner in, so you can bring a practitioner to the house. And if the background, the homework is not well done, you worsen the situation. So the homework must be done well prior to inviting the clinician.
Thank you.
A pleasure.
Sorry, can I ask my question now? Sorry, my hand is out.
Sorry. Irene, you asked the question, right?
Sorry.
Irene, you just asked your question. Okay, Kobna Forsen, yeah, I can see your hands up. You can ask your question.
Yeah, so mine is a little contribution to a case that was presented by, I think, one gentleman who mentioned someone was smelling. And I just want to share, I'm also a clinical psychologist, and I want to share, a similar case and how we managed it. It's actually called somatization, somatoform disorder. And oftentimes it's the case or the condition may not be present, but then the intrusive thoughts that makes someone exhibit, signs and symptoms likened to be like a case like that. And this was a case, for instance, where I saw the patient somewhere around Cape Coast Teaching Hospital. She believed there was a stone particle in the ear. And so they conducted lots of investigations and scans, but there was nothing of a sort. But this person believed that there was a stone in the ear. And so he was brought to the psychology unit. And we realized that indeed, medical lab investigations and scans suggest there's nothing present. But then this person believes. And in fact, the thought alone was even making this person lose weight and then lessen the interactions between her and the people around her. So it stands to reason that indeed something was wrong. And so what we did was placebo. We had to go ask her to, do some few things while she's away at home, and then come at a later appointment date. And we picked a small stone from outside, took her to the washroom, and then decided we're washing the ear. And then, intentionally dropped the stone from our hand as the water was dropping from the ear. And then we said, here was the stone that has been bothering you for years. And indeed, she believed that the stone had fallen from the ear. And that was where the healing started from. So I want to believe this person is also having this consistent intrusive thoughts about body odor. But even though medical report might suggest that there's nothing present like that. So we could tail on that thing. But of course, you need a strong history. You need to, like Dr. Sandra said, you need to interact with people around her, people close to her, and establish the fact that indeed this thought is affecting her mentally and even the relationship around people, to establish a significant cause, so that you won't stand to say she's faking it or she's just making things up. But of course, it has a significant effect on his or her mental health. So that's just a little bit I want to chip in, so that we can judge and handle, help this person out as well. Thank you very much for your audience.
Thank you very much, Mr. Forsen. Doctor, do you have a reaction to that, or I should call on the next person?
Yes, please, we can call the next person. Thank you for the contribution.
Okay. Sabina, you can ask your question, please. Sabina, if you can hear me, you can unmute and ask your question. Hello, Sabina. Okay, while we wait for Sabina, Augustina, you can please ask your question.
Yeah, Doctor, I'm back again. Based on what our brother said, I'm going to add something to it. In the UK, an incident happened because of, no representation of the Black people, because we are living in a multicultural society. This lady visited the hospital, and Black ladies, we braid our hair, and sometimes when your hair itches, sometimes we tap our hair. And this white mental health nurse just concluded this lady has mental health issue. So she just referred her, to go and see a psychologist and be put on medication and stuff like that. And luckily for that lady, there was a Black nurse on shift, and she went, "How do you know this? What made you make that referral?" And she just described her, and the lady went, "Is she black?" She said, "Yeah." "Has she got braids on?" She said, "Yeah." So that's what happens. Her itches her. She's not got mental health issue. So this lady was going to be put on medication for, something that didn't need medication. But on the mentioning medication, at what stage would you recommend someone be put on medication during their mental health journey? At what stage would you recommend medication? Or is it medication that people can easily buy over the counter, like paracetamol? I'm feeling depressed. Oh, let me go and get something over the counter. Is it something that you recommend, or it has to be prescribed?
Well, prior to being administered medication, as mentioned earlier on, you'll be subjected to several investigations. And then where they feel like, for instance, we need to do psychotherapy, and the person is not in the right state for the psychotherapy, then the psychiatrist want to consider giving medication to pave way for the psychotherapy. So for the medication, it's not something you can just go out there to buy. You need to first be diagnosed. And based on that, they will see the treatments to help in dealing with the situation. So it's not a medication you can just get up and say, I think I have this. That's why at the beginning I mentioned that even if you can relate to some of the symptoms that I mentioned, don't conclude that you have this particular mental health issue. You need to go to the clinic. You need to make sure that you've been extensively assessed. The clinician would be in the position to advise which medication for healing.
Okay, thank you for that. I believe there are so many questions to be asked, but due to our time, we would want to take one last question, and then we will bring our meeting to a close. Is there any more questions? Let's see.
Yeah, I lift my hands a couple of times.
Please go ahead.
I've not been called.
Please go ahead with your
Okay.
question.
My question is, when the doctor was presenting, she mentioned about sex being good, that it boosts our mental health. I just want to know, how many times do you have to have sex before you can gain that benefit? And then the second thing is it true penetration, or you need to reach orgasm before you can release that oxytocin, that hormone? It's just confusing because I work in a clinic where most of the African women, most of the Black women that I see, just have sex to please their husbands. So in other case, they are just doing it for their husband. They are not getting any. So do you get any benefit if you just having sex help? I just want to. Sorry, I hope everybody's waiting.
Yes, I kept smiling throughout the question. It's a very good one. It's a really, really good one, an interesting one, yes. And then I'm going to say, faking it, I'm not sure you are going to release what you need to starve your depression or your anxiety. I think since it's about intimacy, you need to be present. You need to be in the moment for it. In terms of the number of times, I wouldn't be in the best position to advise unless there's a medical person on this platform or one of our clinical psychologists here would want to go deep into that. In terms of number of times, I would lie if I attempt to respond to that one. But for the intimacy, for the release of oxytocin and then the endorphins, I think you need to be present. You need to be in the moment with your partner. You need to enjoy it genuinely to release those feel-good hormones.
Oh, okay, thank you very much. Thank you.
It's a pleasure.
Thank you very much. Thank you, Doctor, for your time and the insight you've shared with us. We do really appreciate. We are most grateful, and also to you who came to listen. I believe that you've learned something new and you've had new perspective on the subjects we just treated. Without wasting much time, Harriet, if you're on the line, is there any announcement you want to pass on? Then we will bring the meeting to a close. Harriet? Hello, Harriet, can you hear me? Hello, Harriet.
Sorry, I had a little technical issue. Wow. Thank you all for coming, just as our brother just said. And then I have learned a lot today. I have to be sincere. I'm so grateful to Dr. I can't even say thank you. Thank you is just not enough. We say God bless you for your time and everything today. This is Gisasina Foundation, and we are based in the UK. We support migrants in any way or form. And then I know we're going to have Dr. back regarding the questions that we couldn't exhaust all of them. So I know you all be happy for us to have Dr. back again. And I know Dr. will also be happy to be back with us. Tomorrow we are open, the food bank is open as usual. And then we are starting the pilot face-to-face English classes again. And then I hope everything will go on well as scheduled. Thank you once again for coming, and we do appreciate your presence.
So much, Harriet.
Okay, thank you very much. And this brings us to a close of our meeting. Goodbye, everyone, and do enjoy the rest of your evening. Bye-bye.
Bye, thank you.
Bye-bye.
Bye.
Thank you, Doctor. God bless
God
you.
bless you.
Thank you.
Thank you.
Bye.
Bye.
Bye. Rana, good night. Bye. Good afternoon.
Yeah.
Yes.
Bye.
Bye, dear.
Bye. God bless you, Dr. Sandra.
Bye-bye, Dr. Sandra. God bless you.
Akwesi.
Yes.
Hey, Akwesi.
Adam.
Why you price for me is why for the bus? Why you popular?
Maybe about cleaning on the about with you.
Hey, no, I couldn't let me.
Oh, sir.
You didn't